It's time for another Y107 MU Healthcare Ask the Expert podcast. In May, being Stroke Awareness Month, we've got MU Healthcare neurologist Dr. Camilo Gomez with us. You know, minutes matter, and MU Healthcare delivers the fastest stroke care in mid-Missouri, the region's only comprehensive stroke certification. Let's start with this. Why is it so important to talk about stroke before it happens?
Because stroke is very frequent. It is the fourth leading cause of death in our state. It happens to almost 800,000 people a year. And there are many ways of preventing it, both by controlling risk factors, such as high blood pressure, diabetes, cholesterol, and reducing exercising, not smoking, and things like that, but also by looking at other conditions that can be treated, such as atrial fibrillation, which is a rhythm abnormality of the heart that can actually lead to stroke.
Let's go with the basics here, Doc. Like, how can you tell if someone you love is having a stroke right there in front of your eyes?
Actually, for years, we have been teaching what we call the warning signs of stroke, which is a group of symptoms that can occur suddenly, including sudden weakness of one side of the body or one limb, sudden numbness or loss of sensation in one side of the body or one limb, sudden severe headache that is unexplained and not characteristic to what somebody suffers on a daily basis sometimes or never have had a headache before, sudden loss of speech, the inability to communicate or converse, sudden loss of vision either in one eye or both eyes or partially or total. But the key to success is to identify these symptoms because they're sudden. There's a rapid, quick change in a person from being without symptoms to having one or more of these symptoms. That sudden change should be like a very, very rapid alarm that signals that something needs to be done very, very quickly.
Mm-hmm. Obviously, yeah, minutes matter. I know you talk about calling 911 immediately when you see some of these symptoms.
Without a doubt. The only advice that we consistently give is whenever one of these symptoms are identified is to call 911. It is the best way to assure that the patients arrive within the time frame that we can offer them all of the treatment modalities that we have available at the present time. Every minute that is lost, millions of brain cells die from stroke if we are not on top of things.
Cosmo here in studio with MU Healthcare neurologist Camilo Gomez as we talk about stroke in this month of May, Stroke Awareness Month. MU Healthcare, the place to go, certified comprehensive stroke care. Obviously, you got to be quick. Minutes matter. Call 911. Why is it so very important to get that help quickly if you or someone is suffering a stroke?
Because as we were talking earlier, every minute that goes by, millions of brain cells can die from the stroke, can be injured from the stroke if someone does not receive definitive standard of care. The success of this treatment is very dependent on how quickly it is applied. Stroke is a medical emergency, and as such, the only route to the hospital is via 911. Doctors' offices are not the place for any medical emergency, and that includes stroke. So calling your own physician for a medical emergency is never a good idea because doctors' offices are not equipped to handle emergencies. 911, the treatment begins when they pick you up and they alert the stroke team. And when you come over to a place like ours, for example, there'll be stroke experts sitting there waiting for the patient to arrive. That makes a whole world of difference.
Yeah, as the ambulance crew is getting you there, they're already set, ready to receive you as soon as you arrive. Again, back to that minutes matter. MU Healthcare is ready to deliver that stroke care immediately across mid-Missouri here. Find out just exactly why they earned the region's only comprehensive stroke certification. That's huge. That's a big deal. muhealth.org/minutes matter. Symptoms, obviously, we talked earlier about, the rapid onset of some of these symptoms. What is a symptom that might be overlooked if you or someone's having a stroke?
Well, as we said earlier, some of the symptoms of sudden weakness, sudden numbness, sudden loss of speech, and sudden loss of vision may be easily identified. But there are others that are not perhaps as well known. For example, dizziness. And what I mean by dizziness is more vertigo type, the sensation that the room is spinning around, there is loss of balance, and sometimes, particularly if it's associated with some degree of clumsiness, this could be a sign of a stroke, and I think it needs to be looked at very, very quickly. The majority of patients may not have a stroke, but it's that small percentage that ends up with these kind of symptoms and have a stroke. in whom it makes an incredible difference if they show up in the emergency department within a very, very rapid amount of time.
Yeah, and not to sit around and just kind of wait and go, maybe it's nothing. You're better to err on the side of absolute caution, especially when we again talk about how much time is of the essence.
That is quite correct. We would not want the public in general or people to wait until they are sure they're having a stroke. Even if there is a possibility, it is much better for them to show up and let us, the experts, make that determination, because particularly even if the symptoms are mild, that's actually a good sign because we can catch the problem so early that we can prevent a catastrophe.
Today we're talking with neurologist Camilo Gomez from MU Healthcare about why MU Healthcare and their certified comprehensive stroke care team is the best. You're the best. I don't know to say it any other way. You guys really, you've been certified as the only comprehensive stroke certification in mid-Missouri. What makes MU Healthcare and earning that certification?
I think it's because of it, the organization and the components of it that includes experts in various fields, both like myself, I'm a vascular and interventional neurologist, which is essentially, I've been practicing for 42 years dealing with stroke. And my partners are just as specialized and experts. And we have experts in imaging, in a variety of other areas. And then we have the resources, the physical resources and protocols to treat patients. We have the unique neurointensive care unit to treat patients who are incredibly ill, including from stroke, neurologic illnesses, and specialists, our colleagues who are neurointensivists who staff that unit. We have facilities to provide endovascular treatment of stroke, which is going from the inside, just like when the cardiologists treat a heart attack. We can go from the inside and remove blood clots from closed blood vessels in the brain. And we have research protocols. We are constantly advancing and trying to find new ways to do things better and faster and get better outcomes. So it is that organization that and those protocols and those systems of care that makes us quite unique.
What sets that MU Healthcare stroke care team apart from the rest?
Well, unlike heart attacks, which are really almost all very homogeneous in terms of what they are alike to each other, strokes have different kinds of types of problems. On one hand, you have the type of stroke that is most common, which is the one where a blood clot closes a blood vessel and that tissue of the brain does not have blood flow, and if that flow is not restored, the tissue is injured. But on the other side of the coin, you have the type of stroke which we call hemorrhagic stroke, which is where a blood vessel ruptures and there's bleeding inside the skull and outside the brain, or inside the brain or in the tissue coverings of the brain. Both of these, by attacking all aspects of stroke, we are a comprehensive stroke center, and we have specialists that can deal with every single type of stroke we have under any circumstances. And that, combined with the protocols of care, our commitment to quality and safety, and providing novel treatment strategies such as procedures that frankly, we're probably one of the few in the country that are capable of doing, makes it very unique that the patient who arrives at our doorstep is going to be treated in a way that addresses all of his or her needs.
Dr. Gomez, thank you so much for your time. Really appreciate it. When minutes matter, MU Healthcare delivers the fastest stroke care right here in mid-Missouri, the region's only comprehensive stroke certification. Again, May being Stroke Awareness Month. Log on now, muhealth.org/minutesmatter.